I wouldn't say vast declines, because Google still does have, and Google search still is playing a very large role in referring traffic for the majority of verticals that we have access to and can see. But it is changing quickly. And I think that the pace and the scale of change is like nothing that any of us as marketers have ever seen. And so I would be very remiss to try to predict or forecast when exactly that majority of traffic will start to come through from Gen AI. But I'm curious, our teams collectively have done a lot of work together around content strategy and content production as it relates to SEO and now Gen AI. What do you think? And if you were advising a CMO today of a healthcare system, where should the resources be put relative to content strategy, content production? Just curious on your thoughts there relative to where we're headed in terms of the digital landscape.
Yeah, I had a lot of conversations about this actually over the past year, because I think trying to see through the looking glass here is the real challenge that we're all facing. Yeah, there hasn't been in some industries such a significant decline, that it would be catastrophic. But there are some industries where that is happening. The last statistics I looked at, and I can't remember where the citation is from, I apologize, but some industries are seeing up to a 60% decline in organic click through, and a lot of that is being attributed to the position zero, right? The zero click searches and position zero. So where to get back to the question, where should we invest those resources? I think it's important, at least strategically, to understand that landscape. Our organization is taking steps right now to invest in tools to better understand that competitive landscape. There's been a lot of research. The citation escapes me, but I was just reading a paper about the top citations from an AI perspective, and what health systems are being cited most frequently through AI channels. And there are a number of factors there, and breaking down what is contributing to those factors, I think, is extremely important. I think it's important to understand that while AI is evolving, it is still relatively rules-based, in that it's algorithmic, it's a technology, and there are certain contributing factors that we can look at to show correlation between what we're doing from a content perspective and whether or not we're acquiring some of that positioning. And those things, again, at its core, I go back to, SEO is always important, and content from that perspective is always important. And so understanding what it is that you want to attack from an organizational perspective out there in the zero position game, is a matter of making sure we have tools that can track that, making sure we have proper analytics to measure our contributions in that space, and understanding what it is we want to invest in, to try and acquire some of that positioning. But right now, I'm involved with an organization and our philosophy is strategically to understand, right? To try and educate ourselves, to try and acquire tools that allow us to understand what those queries are that we want to be cited for, aligned with organizational priorities, right? And then, I think Salima made an excellent point that content has always been this beast, right? And that beast needs to be fed, right? And so it's, that's always a question of resources. I think AI is presenting us with a lot of tools and technologies to be able to scale our content. But I think it's approaching content from the perspective of understanding that our content is not just for a place in time and not just for a particular medium, that we have the opportunity, as we're generating content with the limited resources we have, to be able to look at how we can scale that content, repurpose that content, multi-purpose that content in a number of different mediums. So it's a lot to attack all at once. My perspective, as a data-centric marketer, is to, from a data perspective, start to understand what we're seeing, what our competitors are doing, and how we might insert ourselves into that position zero conversation.
Yeah, I think that's a great point. And, something you've all brought up is in terms of the education that is necessary or really required for leadership and or the board, which certainly always helps to fuel and funnel more marketing dollars your way. And so I think, you've all probably been in the position of having to explain, including to service line leaders also, what's available, what the opportunities are. And I think for many, for our panelists and many of you on the line, I think that this is going to get more complex as the landscape evolves and as generative AI really becomes, from a user behavior standpoint, kind of the first stop in the awareness and the research phase. So I'm really curious, Aaron, I'll pose this to you. Our team, through a third party, did a recent survey of marketing leaders all across the United States, and several of the questions were around AI. And 87% of the respondents agreed that it is important to extremely important that their brand have visibility within AI, generative AI. Yet we know very few brands are allocating budget towards actually doing that and having a generative AI content strategy and plan, and to James's point, the tools from a tracking perspective, or to have outside partners helping to come in and educate for how their teams can use AI to become more sophisticated, efficient, effective. So I'm curious your thoughts on all of this, Aaron, and maybe anything that you are currently doing to help in this way as we move towards 2026 planning.
Yeah, well, I think we're in a transition, and just like AI is moving more quickly than maybe we might even hope, and definitely more quickly than we expected. I think that people are starting to see the shortcomings of generative AI and those results more quickly than we might have expected. And I think that, executives are probably seeing the kind of content that they're encountering when they use these kind of tools. They're recognizing that a lot of times it's gobbledygook, right? It's just the same old, same old. And if not, we need to highlight this for them. But I actually think that we'll come up on a bit of a flip side to what we've experienced in the last year, which is, as Salima said, like AI is a plus, right? So we've been in a phase of replacing a lot of maybe, people, resources, and content with the idea that it could just be generated. And we're moving out of that phase of replacement to augmenting our skills. And I think the call is actually that just as we needed great content writers who understood how to write for SEO and understood how to do that without, filling it with, the same word 20 times, right? And all these bad SEO approaches. We need people who are thinking of how do we problem solve? How are we creating the content for our site? Additionally, it's kind of like the greatest personalization opportunity we've ever had. If your team understands how to write content to solve problems, if they're aligned, if the technical approach is part of your content strategy, that you're using structured content, you've got a schema strategy, your content role players are a part of that schema execution. The reality is, I do think more content will be pulled up when it's appropriate. And again, that's a huge personalization opportunity. I'm concerned as, being in a regional health system. You don't see the prevalence that we'd like today. I still think if you're focusing on physician data, location data, you're going to be there. right? You like as these tools want to help, help people who are searching for a doctor in their area for a specific need. If you've developed that structured content and schema, you're going to appear. But as we become more sophisticated in rethinking our overall content, our service line content, and and how it helps people, other forms of content that we might want to produce, I think will appear there. Maybe not, to the extent that we once appeared in Google rankings, but will appear when it matters, right? And I think for local health systems, especially among local searches where it's most relevant. Again, like the generative AI wants to personalize that content as well for its audiences. So so I think the argument to executives is showing how the technology works, the sophistication that's required, and showing the measurements where you can.
Yeah, no, I think that's great. Salima, I'd like to ask you, if you were advising a CEO or C-suite at a healthcare system right now, what advice would you be giving to them for how they could lean into AI to become a leader versus lagging behind? What are some of the things that they could be doing? Where could they be investing in? What actions could they be taking so that they would be ahead of the curve and have that competitive advantage through AI?
I think that progressive systems, and I think that we are an assortment, right, of types of organizations in terms of those that are more forward facing and progressive versus those that are sort of lagging in that. And I think James's role is a really testament to some of the great work that Virtua is doing in terms of really having the right people in the right seat at the right time, to be able to really face some of what you're asking about. So I think from a C-suite perspective, it's first understanding what role AI will potentially play as it relates to those business goals and those strategies, and then being able to really assemble the right team in order to be able to lead this effort. This is certainly not a one-person deal by any means, and so having that really synchronized and synergistic relationship with IT, with finance, with legal, with operations, clinical leadership. It really is that cohort of individuals coming together to be able to really understand both strategically and technologically what it requires in order to be able to move down that path. But I will say something too that's maybe a bit repetitive from some of our comments, but also incredibly important, and that is understanding the needs of your patients, your customers, I think has never been more important. And when Aaron talks about the idea of being able to really customize and personalize, I think, we all know at this stage in the game, there is nothing more frustrating than having just automated responses from a chatbot or from an AI mechanism that is very generic and very broad based and is really not speaking to me about what I need. And I think that there is unbelievable opportunity in healthcare. We are the subject matter experts, obviously, in terms of delivering that care, and we need to become the subject experts in terms of understanding what our patients want from us, and being able to really leverage that data in order to be able to create this customized approach. So I think that it's perhaps a three-step process, Danielle, in terms of what that C-suite needs to understand. Again, never been more important to understand what those needs are, being able to really assemble the right team in order to be able to really align that with the business needs, and then be able to execute in a crawl, walk, run approach, right? This is not going to happen overnight, and especially given the dynamic environment. But I think it is trying to prioritize a couple of those areas where you could perhaps test and fail or test and succeed and build from there.
Great. And as we kind of wrap up here in the last few minutes, I'd like for each of you to weigh in, please, with some final thoughts. James, we'll start with you. And, what's either looking ahead to 2026, something that, everyone listening today should really have on their radar as a action item, or what's one thing that you really feel like we didn't cover so far in the conversation today that shouldn't go unsaid before we wrap? Just parting thoughts from all three of you, and James, you can kick it off for us, please.
I think I'm going to take a tack through the middle of those two questions. So I think we did talk about several areas that I do want to re-stress. And I think that while we did have a nice hefty sort of presence of AI within the conversation, I want to step back and I think to Salima's point, and I think from what Aaron was saying as well, we all need to understand that, well, there's two sides to this coin. That it's not going away, right? It may not be having the impact we think it's having, or we see in other industries, and we may be able to be present when it matters. And I think that's absolutely true. But the technology will keep evolving, right? And it will disrupt us in ways that I don't think that we can even anticipate at this moment. But all of us on this panel, I think we've been through a number of these quote unquote revolutions, right? And I think what I would want to re-stress is that the foundational elements, and again, forgive my bias from being, on the data side, the foundational elements, whether it's in data, whether it's in analytics, whether it's in attribution, whether it's in content generation, are extremely important. To the point of crawling, walking, and running. I've heard that so many times in my career, and I think it's a great way to express how we need to grow. But we as marketers, we as the sort of leaders and advisors of our organizational leaders, need to really encourage them to get past the crawl. Right? So many times we step into crawl, walk, run, and we never get past the crawl. Right? And technology evolves beyond, even what we were assuming was going to happen. So I think that now there's no better time, no greater impetus than what we're seeing with technology to really start to lean in on understanding our data, understanding how we can bring our data together, and understanding how we can leverage that data to analyze, to measure, to forecast, but also to connect, to communicate, to bridge the gap, to be present for consumers as they become our patients. So that I would leave it with that.
Awesome. Kill the silos. Kill the silos is definitely
Yes.
something that I think could be a great mantra going into 2026. Aaron, how about you? Final thoughts or anything we didn't cover that we should have, or what's on deck for 2026?
Well, I will say, I think James summed it up really incredibly well there. I would just piggyback by saying what we've heard a lot through this, like focus on customers, focus on providing value, good foundational ways to do that through our data and our approach. And I do think a lot of our role is, again, just keeping us moving downfield. If you've said something 29 times, you're just getting warmed up. People, you got to keep the focus. And I think if we do that, I think we'll be rewarded, because the tool sets want value. The tool sets want to provide value to the customer base as well. And so as long as we tap into that, in some ways, fundamentally nothing has changed.
Good point. Good point. Salima, you want to bring us home?
Sure, I'll be brief. I think that however and with whatever resources you can, be part of the team that really carries the organization forward. And I think if that means investing the time over the next 3 to 6 months to begin to audit your data infrastructure and to really be able to formalize whatever your organization's focus is going to be on AI governance, it's an absolute imperative. You have to be able to find a way to be able to do that, to be able to move the game forward. I think that we would often say, I think in some of my past experiences, you either disrupt or you will be disrupted. And so I think that we all want to be on the side of that, where we are kind of leading the effort. And then I think finally, just the idea that experience and brand are completely synonymous. Without that experience in every possible engagement, whether it's through AI, whether it's an in-person experience, ultimately that becomes the reflection of the brand of the organization that you are. And so I think any opportunity that we have to be able to really use that voice of customer, to be able to underscore whether the experience is positive or negative, we have an unbelievable ability and value there to be able to deliver to organizations and really help them understand that ultimately that becomes the representation of the brand. We want it to be the best it can possibly be, because that's what patients in our community deserve.
Absolutely, absolutely. Well, this has been an absolute masterclass in healthcare marketing from the fantastic brain trust that we assembled here with all of you. Thank you so much for your time, your insights, your perspective. Incredibly valuable conversation. We've been getting a tremendous amount of positive feedback through the comments here. We did try to incorporate a number of the questions naturally into the conversation, but if we didn't get to your question, we certainly will reach out and follow up one-on-one afterwards. On behalf of the More Visibility team, Salima, James, Aaron, thank you so much. Wishing everyone a wonderful afternoon. This is meaningful work, and we all need to continue to push it forward. Have a great day. Take care.
Thank you. Bye-bye.